Climate change is a health problem, and it affects the society in a number of ways. It can affect food production, it increases poverty, it can shift the patterns of and distribution of vector-borne diseases. It increases the number and the intensity of natural or extreme weather events, natural disasters, and it affects everyone and everywhere. Of course, that's the poorer parts of the population, they are more vulnerable to the climate change effects, and other parts of the population might be more affected by climate change effects. For example, during a heat wave, outdoor workers are particularly vulnerable, and pregnant women and other persons with specific health conditions. For disasters, there's a number of countries and regions who are more affected than others. With effects of sea level rise, particularly islands and coastal zones are vulnerable to climate change effects. So that's why we say that climate change is the biggest health threat of the 21st century, but it's also a big opportunity for improving the health systems toward a more resilient health system. And that's what is going to make us or our countries more resilient to climate change in order to bring health for all. So the challenges are being put by climate change. They are exacerbating some conditions that exist, and that's why we need to tackle the climate change effects, but also by reducing greenhouse gas emissions even within the health systems, but also on adapting, meaning responding to climate change with proper plans for preparedness, response, quick recovery, and disease prevention. So this is a task for all, not only from the health sector perspective, but it's a task that is worthy fighting, because climate change is one of the largest threats that we face in the next century.